The postmortem interval was estimated at 6 hours. The physical evidence suggested the estimate was wrong. The cause of death was listed as natural. The medical examiner disagreed, initiating a comprehensive forensic investigation to uncover the true circumstances surrounding the deceased's demise. Initial findings revealed inconsistencies that warranted further scrutiny beyond the surface-level assumptions made by first responders and initial law enforcement assessments. As the case unfolded, it became clear that the physical evidence and toxicological data would provide critical insights into what truly transpired. On a cold winter evening in downtown Seattle, a passerby noticed an individual slumped against a wall outside a popular nightclub at 1:30 a.m. on February 24th. The individual was later identified as the deceased, a 35-year-old male with no known medical history or recent interactions reported to authorities. Initial bystanders assumed the man had fainted due to alcohol consumption and cold weather exposure, calling emergency services who arrived shortly thereafter. First responders noted that the deceased was unresponsive, but not in immediate distress, with no visible signs of trauma or injury except for mild frostbite on his exposed extremities. His body was positioned in a seated posture against the building wall, leaning slightly to one side. A faint pulse and shallow breathing were detected initially, leading medical personnel to administer CPR before transporting him to a nearby hospital emergency department. Upon arrival at the hospital, the deceased remained unresponsive despite resuscitation efforts. After several hours of unsuccessful treatment, he was pronounced dead at 4:15 a.m. The initial manner of death classification by on-site medical staff was natural causes, due to presumed hypothermia and alcohol intoxication without any apparent signs of foul play or violent injury. However, the medical examiner's office received a referral from the attending physician, who noted inconsistencies in the deceased's condition upon arrival at the hospital versus his body temperature and physiological state post-mortem. This discrepancy prompted an immediate forensic investigation to uncover potential underlying factors that may have led to the unexpected death of the deceased. Chapter: Forensic Investigation. The technical core of the episode delves into the meticulous procedures undertaken during the autopsy and subsequent laboratory analyses, revealing crucial details about the deceased's condition at time of death. However, the medical examiner's office received a referral from the attending physician, who noted inconsistencies in the deceased's condition upon arrival at the hospital versus his body temperature and physiological state post-mortem. Evidence collection commenced with a thorough examination of the scene, identifying several key items including empty pill bottles labeled as prescribed medications for chronic pain management. Physical evidence recovered from the scene included various drug paraphernalia: syringes, used needles, and small plastic bags containing powdery residue suspected to be illicit substances. Additionally, personal belongings such as a cell phone displaying recent calls and messages related to substance procurement were collected under strict chain of custody protocols. Notably absent was any form of identification or significant financial assets that might indicate the deceased's social status or daily activities. Laboratory analysis commenced with toxicology screens, which included comprehensive drug panels designed to detect both legal and illegal substances, along with alcohol levels. The test results confirmed elevated blood concentrations of opioids, specifically fentanyl and heroin, far exceeding lethal thresholds established by medical literature. Histological examination of tissue samples revealed significant respiratory depression consistent with opioid overdose, corroborating the toxicology findings. Timeline reconstruction efforts utilized forensic entomology to estimate the postmortem interval more accurately than initial assumptions suggested. By analyzing insect activity patterns on the body and correlating these observations with environmental temperature data recorded at various times throughout the night, investigators concluded that the actual time of death occurred approximately 12 hours earlier, around midnight on February 23rd. Timeline reconstruction, efforts utilized forensic entomology to estimate the postmortem interval more accurately than initial assumptions suggested. Expert testimony provided by forensic toxicologists highlighted the significance of detecting multiple substances in combination, underscoring how the presence of fentanyl amplifies the lethality of heroin use. The expert also addressed uncertainties regarding exact dosages consumed and potential interactions between different drugs present within the deceased system. Chapter Resolution. The final determination shifted away from initial assumptions towards a definitive cause of death attributed to drug overdose involving multiple substances. This change in assessment was supported by toxicological evidence confirming lethal levels of opioids alongside documented respiratory failure consistent with acute intoxication syndrome. What changed from the preliminary investigation was recognition that environmental factors alone did not account for the severity of the situation. Rather, the precise nature and combination of drugs played a critical role. Chapter Close. The file remains open, illustrating the necessity of thorough forensic methodologies in accurately determining cause and manner of death amidst complex scenarios.